Good morning, guys, and welcome to today's free webinar with 2 Health. My name is Mark. Today we're going to be looking at and talking about sleep and how important sleep is for us, and especially the impact that sleep can have on our performances as an employee and our day-to-day life, basically. Okay. So remember, these are free 30-minute sessions. Our webinars are all free. They're on our YouTube channel. So it'd be ideal if you could take the time to pop over to the YouTube channel and subscribe to those, so you can visit those 24/7. You'll be able to access this webinar and our other free webinars also. There's loads of topics on there. We go into a little bit more depth as well into some of them. But as I say, there's sessions available through our website and through also some of our YouTube and social media channels. Okay, if there is any inquiries, there's a email address here that you can contact for any other webinars that you think may be useful for you and your employees. Okay, let's make a start. So some of the things we're going to be looking at today. Okay, why do we need sleep? Really important. Sleep is massively important, as you probably know. So we're going to have a look at why do we actually need it and what sleep is. We're going to look at something called a circadian rhythm. We're going to have a quick look at some stats and facts, and some of these are quite surprising, how much money is spent or lost on lack of sleep. So we're going to have a look at some of the impact of lack of sleep and what it does number wise and some facts. Then we look at hygiene. Now this can be environmental or it can be some sort of habits. Okay, we're going to look at benefits and dangers, or good versus bad sleep patterns. Okay, and then shift work at the bottom. It's quite important. Obviously, a lot of people are working shifts outside their normal 9 to 5 hours, so the circadian rhythm is a little bit different. So we're going to have a look at that in a little bit more depth. Okay, but sleep is really, really essential for, and it allows our body and mind to recharge, leaving us refreshed and alert from when we wake up. Healthy sleep also helps our body to remain healthy and stave off any diseases. Okay, so without sleep, our brain can't function correctly. It can impair our abilities to concentrate, think clearly, and process any sort of memories. As you probably know, most adults require at least 7 hours of nightly sleep. Children and teenagers need a little bit more, and particularly under 5 need substantially more sleep. You'll probably see that pattern if you have children. The younger ones need more sleep than the adults. Work schedules and day-to-day stressors, destructive bedroom environment, any medical conditions can all prevent us from having enough quality sleep. Okay, you know, healthy diet and positive lifestyle habits can ensure that adequate amounts of sleep each night are available for us. But for some of us, chronic lack of sleep may be the first sign of a sleeping disorder. Some of you guys might have experienced sleeping disorders in the past. I've been close to people who do have sleeping disorders, and it's not great. Their lifestyle is not great without the lack of sleep. So sleep and our circadian rhythm. Okay, sleep is the normal process that allows our body and brain to rest, as I've just mentioned briefly. But for most people, it's just a matter of getting comfortable within your bed, closing your eyes, and drifting into a slumber. But despite how simple this seems, sleep is one of the most complex and mysterious body processes known to science. And if you're not getting enough sleep and your quality of sleep isn't good, you'll probably know about it just from how you're feeling. Okay, without enough quality sleep, our body and brain can't work efficiently or as well as it should. Okay, our circadian rhythm, it's our 24-hour body clock, and it's located in our brain. It's controlled through light and dark cycles, which in turn regulate numerous physiological changes within our body. Okay, it's influenced by external factors such as light and darkness. It helps to synchronize various physiological and behavioral processes within the day-night cycle. The SCN in our brain, in the hypothalamus, is the master peacemaker, and that controls our circadian rhythm. It's a very complex process, all this circadian rhythm, and we're just briefly touching on how it works. Okay, but maintaining a regular sleep schedule and exposure to natural light during the day while minimizing light exposure at night time. We want light in the day, minimal light at night time. This keeps our circadian rhythm in sync. And disruptions to this rhythm, such as maybe jet lag, I've mentioned shift work at the start, irregular sleeping patterns, can all lead to disturbances and affect our overall health and well-being. Properly regulating the circadian rhythm can improve our quality of our sleep and promote overall health, both physical and emotional health. Okay. Some little facts and stats now. We're going to talk about little sleeping in numbers. We naturally fall asleep around, or we naturally feel sleepy around 2 p.m. in the afternoon. I'm probably seeing a lot of you guys nodding now. You're probably going for that coffee at 2 p.m. in the afternoon. These are the two areas where we do tend to feel sleepy, 2 a.m. and 2 p.m. And we do that afternoon, we try and go for that coffee to have a bit of a pick-me-up, let's say. That's all well. Just be mindful that caffeine has a half-life of 5 to 6 hours, which means it's in your body for those amounts of hours after sipping your last sip. So, yeah, 2 p.m, maybe keep that as your last caffeine intake. Anything over that, and it's likely you could be disrupting your evening sleep, okay? So just be mindful of having caffeine. Anything later than that, it could disrupt your hours through the night. Working night shifts, it has about 25 to 30% higher risk of injury compared to those working in day shifts. And again, this is something we'll cover shortly when we talk about the shift patterns and the risk factors later on. Better sleep is the biggest contributor to overall better living. Makes sense. This one was really interesting here that we found 200,000 working days are lost due to insufficient sleep at a cost of £30 billion, which is a hell of a lot of money. So this is how important that getting our quality sleep is for our lifestyle, for our job roles, for our performances. Okay. So we've got good sleep, bad sleep. We talk a bit about hygiene here. When I talk about good sleep, maybe it's the benefits of having good sleep. Okay. The quality sleep has benefits of improving creativity, maybe our decision making, impulse control, and emotional reactions. All these are key components of resilience, and that's what we need to do, is build our resilience up. Okay, good night's sleep does not only help us feel physically well, but also it's important for our emotional health. All right, so it's not just how well we feel physically. Our mind is a big part to play with the quality of sleep that we are having. Okay, and there's several studies throughout the years that's been linked as well with obesity and poor sleep patterns. As we probably know and remember, like, obesity is the second leading cause of cancer, only behind smoking. So it's really, really important that we're getting these quality sleep hours, so we're not reaching for unhealthy habits. Okay, because it has been suggested that people who regularly sleep less than 7 hours a night are more likely to have a higher BMI than those who don't. And then having a higher BMI, you could develop obesity further down the line. Okay. It might be the fact that a lack of sleep it's associated with higher levels of ghrelin, which is our hunger hormone. Okay. Also noted that a decreased sleep results in increased fatigue. And that's probably the reason, and it affects the people's desire to ability to exercise and maintain a healthy body weight and lifestyle. I, for one, have experienced this. When I feel tired, I don't feel like eating healthy food. I tend to go for convenience food, those that are less healthy, those that are higher in sugars, those are a lot higher in saturated fats. So there's a big knock-on effect from this lack of sleep and making us feel tired. I don't want to go to the gym. I don't want to go out for a run or walk. So there is a big knock-on effect. Okay. Other benefits can include a reduction in stress levels, stress and sleep. I've been having conversations about this all week with some of my clients, and their stress levels are really high. Quality of sleep is really low. Which came first? Stress, lack of sleep. Are we tired because we're stressed, or are we stressed because we're tired? Okay. But maintaining good relationships is another benefit of having good quality sleep. Okay, both inside of work and outside. If you look at some dangers now, or the risks of having bad sleep, okay, being drowsy through the day can increase the risk of car accidents and injuries through other causes. I'm not teaching you to suck eggs. That's an obvious one. Increase if we're tired, we're not alert, we're not paying attention, we're not focused. It's likely we're going to have increased risk of car accidents and injuries. Okay, if you sleep less than 5 hours, then you're at risk of increased blood pressure, and a lack of sleep can affect your balance and coordination, so making you more prone to having more falls. Okay, and physical accidents, not just falls. But that blood pressure one is really important for me. Stress and blood pressure are massively linked. Stress and sleep are massively linked, and our blood pressure is really, really important. We don't want to elevated blood pressure, and you know the risks of elevated blood pressure. It's something we need to keep at a normal range. Okay, and sleep is massively important to this. Sleep deprivation can make you moody, quick-tempered, emotional, and chronic sleep deprivation can affect your mood and lead to anxiety and depression, which then can escalate into further mental health problems further down the line. A lack of sleep can affect your body's release of insulin as well. This is another important one, which is insulin's our blood sugar lowering hormone. So if we don't get enough sleep, our blood sugar levels tend to be high within our body. Again, this can increase our risk of diabetes. Losing sleep can impair our body's ability to fight off any illnesses, making us a little bit making it easier for us to get sick. And research suggests that there's a relationship between sleep and the immune system. So you may lose additional sleep while your body fights off that bug or that illness that you've got. So being aware that we need enough shut eye and sleep for our immune system is really, really important. I hope that makes sense. What can we do? So hygiene, sleep hygiene. It refers to both the environment that we're in and the quality. Okay, sleep hygiene includes setting maybe a strict sleeping schedule, following bedtime routines, forming healthy habits, optimizing your bedroom for sleep in regards to maybe having a dark room, having a nice cool room as well. Some people like to go to bed with a warm room, and it's not always ideal for a good quality night's sleep. Another tip here is maybe try having a warm bath before bed. What this does, it will increase your core body temperature, meaning that when you get into your cool bedroom after the half an hour bath that you've just taken, your body temperature will quickly fall, and this promotes melatonin, which is our sleep hormone. Okay, so maybe having a warm bath, trying a little bit of meditation can all impact us having a good quality night's sleep. Naps is another one I get spoken to about. People like to have a nap. Naps can be a handy way to regain energy during the day, but it can throw off our night sleep as well. So if we are going to have a nap, if we can keep the nap under 30 minutes, ideal. Anything over 30 minutes, you're at risk at disrupting sleep in the evenings. Okay, and sleep hygiene does not always cure your sleeping problems. Okay, they might help, they might not. It doesn't always cure them. So if you are struggling, please see a doctor or a sleep specialist who can recommend other treatments or best treatment for you guys. All right. So what are the signs of some of the poor sleep hygiene? Having hard time to fall asleep. I've experienced that a lot in my time. Experienced frequent sleep disturbances. Suffering daytime sleepiness is a big one. These are all telling signs of poor sleep hygiene. So if you can take anything from this slide, have a look at some of the improvements that you can do within your lifestyle throughout the day, maybe coming up towards the evening, that you can maybe start to promote this melatonin when it's dark outside, and try and improve your sleep hygiene, maybe using a few of these. Hopefully some of you guys are using some of these already. An overall lack of consistency in sleep quality and quantity is also a really big symptom as well. I read the other day, we only need 80% of our sleep quantity to be quality to have a good night's sleep, if that makes sense. So it is natural for us to get up in the night and use the toilet, for example. A lot of us will have children, but if we're getting 80% of our sleep that is quality, we should be good. Sleep and emotional resilience. Resilience is a popular term to be used in healthcare settings, describing the ability to adapt, to move forward from difficult situations, from stresses, from adversity or trauma. We all face challenges within our lives, and one way of building resilience is from promoting this good sleep and having a good night's sleep. If we haven't had a good night's sleep or quality sleep, our brain becomes hyperreactive, meaning that we're more likely to interpret external events as a threatening behavior or something that's going to make us feel more anxious and irritable. There's also growing evidence that around the relationship of poor sleep and mental health conditions such as depression and anxiety. I've just touched on anxiety a little bit there, but the relationship between sleep and our emotional resilience is interconnected. As mentioned, a lack of sleep can lead to feelings of stress, but also impacts our ability to sleep. So again, going back to that situation, what I mentioned at the start, stress and sleep is pretty much what came first. Is it the chicken and egg situation again? Are we stressed because we can't sleep, or the opposite way around? And remember as well, stress isn't actually a mental health condition, but persistent stress can lead to conditions that we've just mentioned, anxiety and depression. Okay, managing stress levels is really, really important with mental health. We'll talk a little bit about shift work disorder now. Okay, so during the day, our retinas in our eyes perceive sunlight and signal to the brain to release hormones such as cortisol, which is our stress hormone, and this keeps us feeling alert and energized. As the sun sets and the light fades, your brain produces other hormones such as melatonin, which induces feelings of relaxation and maybe sleepiness. Okay, that's what you want. We want the stress hormone through the day where it's nice and light, where we can do all our work, where we're feeling alert, and then we want melatonin in the evening. Okay, shift work disorder is a condition that primarily affects people who work outside certain hours, maybe work at night, early mornings. Rotating shifts is a big one. all these can play part of our circadian rhythm and our melatonin levels. Okay. So the disorder may cause insomnia, then workers attempt to sleep or have excessive sleepiness while they're at work, which obviously is likely a higher risk of having accidents during our work day. The average person with work disorder loses 1 to 4 hours of sleep per night, which is massive. I have a lot of friends who work shift patterns, and sleep is a massive issue for those guys. It's not as easy. A lot of working hours are outside of these 7 till 6, so it's really important to try our best what we can do for our sleep hygiene to improve our sleep, especially if we're working within these hours or outside of these hours. Okay, so treatments. What can we do if we are working outside of these 7 till 6? If we do have maybe a little bit of a sleep work disorder, using light boxes at work. These have been used before. Many workplaces that don't have natural sunlight, light boxes are a useful tool. Turning up lights during the night shift as well may help you feel more awake. Although for sometimes when you need to sleep after the night ends in the middle of the day, again, it's going to be light, so we need to promote that darkness. Maybe wearing dark sunglasses or sleep mask would be a better option and more comfortable when coming out of work. Okay, just to try and minimize that sunlight promoting effects, let's say, that alertness. When we've finished through the day, we need as much darkness as possible. Okay, melatonin can also be purchased as a supplement. Not always recommended, but it can be. But improving your diet is something where I'd start. Eating food rich in something called tryptophan. This promotes the release of that hormone melatonin. Some of the examples of foods are eggs, some fish, especially salmon's a good one, milk and cheese. They're all good ones. Lean meats are also good. Okay. GPs can also prescribe medication, as you're probably aware of. However, I would suggest you doing this as a last resort. Making some lifestyle changes that we've just mentioned is where you really would like to start or need to start. Okay. What can we do? How can we improve our performance? If sleep loss is causing you to be excessively tired at work, it might be time to take some changes. Okay. Getting consistent quality sleep can help you perform better at work, reduce your reaction time, and leave you feeling more motivated through the day. I think motivation and performance massively key, in my opinion. A few simple lifestyle adjustments can improve your sleep quality and optimize performance. Okay, so what can we do? Assess your priorities. It's common to sacrifice sleep in order to finish work, watch television, or socialize. Consider ways you can justify staying up past your bedtime routine, and decide if these activities are actually worth the side effects affected with sleep deprivation. Do we need to stay up till half 12 at night time to finish watching that film? Could we watch it another night, finish watching it another night? Seek professional support. Okay, if your work schedule is causing you to lose sleep, it might be helpful to discuss this issue with maybe your supervisor, your union, or your company's HR department. Research shows that allowing for psychological detachment after work hours and supporting employees needs to be consistent. Sleep pays dividends by improving concentration, productivity during the work day. So better sleep with quality we have, more productive we are. Again, I know it sounds simple, but that's how simple it is. Sleep and productivity massively linked. Be realistic. Not everyone can change their work schedule. Many people need to work shifts, as we just mentioned, and that conflicts with the ideal sleep-wake cycle. We've just mentioned that. Okay, so if you struggle finding flexibility in your work schedule, maybe consider other adjustments to your routine that help you stay awake when you need to. All right, be realistic. Again, just nipping back to this, improving your sleep hygiene. As mentioned, hygiene is about fostering good habits that promote restful sleep. Making a personalised plan for optimising your bedroom environment. Again, that cool environment, dark room, etc. Plan for maybe maintaining a consistent sleep schedule, going to bed at a certain time, setting an alarm for a certain time, so you're getting those hours in bed. And eliminating any daytime habits as well. So turning off maybe your phone in the evening. I know a lot of us use our phone for an alarm clock, but maybe go back to an old-fashioned alarm clock. So your phone's out of your room where you've got emails and things coming to your phone that might disrupt your sleep. Okay. Talk to your doctor. Again, there's doctors, sleep specialists that are experienced in helping people who are having these sleep problems. Your doctor might help create a better plan for you to improve. You might be missing something. Your doctor might come up with something new. Offer personalised tips for managing work-related fatigue as well. So if you've tried everything within your power to improve your sleep, maybe talk to a professional, maybe go to the doctor, and see what ideas that your GP has. Okay. So what can we do now to support employees to have a better sleep? Coming onto this webinar is one. Educating is a massive part of trying to improve people's sleep, but having to create a positive sleep culture within your workplace. And this may be including sleep as part of a well-being strategy. A good place to start is to bring a discussion to sleep out in the open, educate your managers, senior leaders within the workplace. Okay, educate them and bring that culture that it's really, really important to have a positive sleep pattern. Increase communications with employees to remind them to take proper breaks. I've worked in a lot of places and people are sitting down for 8-9 hours they're not even moving from their desktop, and it's not great. So encourage proper breaks, making sure people limit time screen, and to improve their motivation, take their annual leave. Make sure they're taking that annual leave and not taking their work on their annual leave. So trying to promote that type of culture. Set an example for work-life balance by encouraging managers to switch off from work. I've just mentioned about not taking your work away with you on your annual leave. Okay, turning your emails off in the evenings after work or at weekends. And if the emails do need to be sent out of hours, include a note at the bottom of the email to say that an immediate response is not really needed. Okay, try and encourage employees to do the same with those. Try not to work outside your hours if you can help it. Provide employees with sleep education. This is one of them. I hope there's a lot on this session today, and I hope you've took some tips from it. But yeah, providing some education to increase the awareness of sleep deprivation, and the impacts, the potential impacts of overall health of sleep deprivation. Taking a proactive approach and encouraging employees to seek help early if they are suffering with sleep issues. Make sure they are going to get the support that's needed. Okay. Setting clear expectations regarding work hours. This enables us to draw a boundary between work and home life. As I've just mentioned, once work's finished, let's try and switch off a little bit from our emails, etc., working through the night. Let's try and have that balance, that healthy balance, okay? And encourage employees to get access to light, especially in the mornings as well, okay? It can include light boxes, but ideally, natural light is what we really want. When you come downstairs, open those curtains or blinds, make sure we're getting daylight within the first few minutes of waking up, okay? And encourage employees to exercise regularly. It's really, really important to promote a good sleeping pattern via exercise, okay? This also reduces the risk of risks associated with a sedentary lifestyle. Okay, we've mentioned obesity at the start, but if we're moving more, hopefully we're keeping our body weight in line. Okay, so encourage getting outside and exercising, going to the gym, etc. Find something that you enjoy to exercise and you'll stick with it. Okay, going to the end now. Quick summary. I hope you found it interesting. Sleep quality, massively important for the lots of reasons we've just mentioned. It supports mental and physical health, and it contributes to overall quality of life. Poor sleep quality and sleep deprivation can have many negative effects. These can be physiological, which can be increased risk of stroke, heart disease, high blood pressure I've mentioned. So really, really important. Okay, negative effects can be also psychological, irritability, developments of anxiety, depression, stress factors. Okay, improving sleep hygiene. Again, I keep going over this sleep hygiene. Just try a few. Having the correct and consistent routine to help improve your quality of life and your quality of sleep. Start with that. Going to bed at a certain time, waking up at a certain time, if possible. Nice dark, cool room with no distractions such as a TV. I don't know if a lot of us do have TVs within our room, but get it switched off at a certain time, an hour before you go to bed would be ideal. And remember, if you feel that you've tried everything that we've spoken about today, please seek professional help such as your GP. All right. So we have come to the end now. Thank you for attending. It's been good. Thank you for listening and joining me today. Hope you've enjoyed it. I hope you found some of the content useful. Okay, so this is a feedback one for us. It's really helpful to make our sessions more enjoyable, better quality, more content. Okay, so if you could follow the link on this Trustpilot and leave us a nice review, that would be fantastic. Enjoy the rest of your day. Okay, thank you for attending again, and getting in touch as well. Get social with us. We're on our social pages, so please, as mentioned, like and follow all our socials there, and share some of our content and subscribe. Thanks, guys. Thanks again. You have a good day.